Welcome back. The great debate over national health care continues, and this morning we're speaking to Dr. Jack Shim from the California chapter of the Alliance for Patient Access. And the topic this morning is a code of conduct that is being proposed, and your group is supporting it to help patients in our nation get better health care, basically. Good morning.
Good morning. Thank you.
Thanks for joining us. Let's talk about the issue at hand here. It's really how people are treated, how people are cared for in this country, and the restrictions that some insurance companies put on patients, right?
Exactly. It's very common for physicians to find that their decision-making that they've elaborately worked out with their patient in terms of testing or choices of medications are overridden by an insurance company that tells them, for example, that the medication your patient is taking is too costly, even though it's working perfectly well for them. Great example would be someone who's stabilized on a high blood pressure medicine and then is told they have to switch to something that hasn't even been tried on them.
And it's only because that medicine that's being recommended is cheaper.
Precisely.
There was a recent survey that came out. Doctors commented on various issues. Let's talk about that because some very interesting things came out.
Well, about a year ago, the California Medical Association surveyed physicians in California. They had about 400 respondents. Over 90% of the physicians who responded commented that their decision-making had been impacted negatively in terms of choosing medications for their patients, what tests would be approved, allowed to pursue interventions, hospitalization.
So do you think people are dying because of these decisions, because of just shortchanging patients when it comes to health care?
I'm sure that it must be happening. It's hard to prove, but clearly just in my own practice, it's very common to see individual medications that my patient and I have tried to choose for them or a test that I thought was necessary to clarify their diagnosis overridden. And then you have to try to call someone, a physician who may not even be in your same specialty, trying to tell them or convince them why your individual patient needs something that me as a specialist have already determined is the appropriate thing.
And these patients include patients that have health insurance and that pay premiums every month.
These are all insured patients, exactly.
So tell us about this code of conduct that you are backing.
The American Medical Association has put together a resolution that was compiled in November and is scheduled to be voted upon in June that is intended to foster transparency in decision-making across insurers, try to establish a level playing field so that, for example, when a patient looks at choosing one insurance company versus another, they have an understanding of the way their decisions are going to be impacted by the payer.
Give us an example or a laundry list maybe of some of the drugs that insurance companies really try to skimp on.
Well, I'm a neurologist, so I can speak most clearly to the things that I see. But for example, our patients with epilepsy may need to be on an anti-seizure medication, and there are medications that are generic and there are medications that are brand named. It's true that a generic medication is the molecule itself the same, but the dosing that is allowed within the generic is much wider allowance or tolerance. And so there's the concern that patients may have, for example, well-controlled seizures, get switched from one generic to another when their pharmacy gets a better deal on generic B than A that they got last month, and have a seizure while they're driving.
Now, the opposite end of that argument would be that many doctors are in cahoots with these drug companies, and they just want to bring in that extra income to stay in good favor with the drug companies.
I absolutely agree that is abhorrent, and I think that the relationships between physicians and insurance companies likewise needs to be transparent. I have heard but not seen that insurance companies may put together lunches or dinners and tell their doctors, well, look, if you manage to constrain the costs by prescribing generics, there's this for you at the end of the year. And I think that really clearly intercepts the decision-making between an individual patient and a physician, if the physician is not looking out for their patient's interest.
So when does this vote go down, and what do you expect to happen?
The vote is anticipated in June, and it's hard to see anyone who would oppose this, so I would expect that it's going to be successful.
And if it passes, what happens then?
Good question. I think that the plan, as I read the resolution, is that this would then be brought out to the insurance companies and say, here we have a national consensus by physicians that requests a process by which information is compiled, perhaps put together on websites that individual patients can see, and standardize decision-making, or at least the process for decision-making across the country.
So then it really is ultimately up to the patient, once again, to check those websites or check that background information before choosing an insurer.
Absolutely.
Dr. Jack Shim, thank you very much for your time this morning. I appreciate it.
Thank you.
Nice to meet you.